Welcome to my channel, Body Talk. Introduction. Diabetes. People of all ages are susceptible to the prevalent illness known as diabetes. Diabetes comes in a variety of types. The most prevalent is kind 2. You can control the illness to lead a healthy life and avoid problems by using a combination of therapeutic approaches. Overview. What is diabetes? When your blood sugar glucose is too high, you develop diabetes. It arises when your body isn't reacting appropriately to the effects of insulin, or when your pancreas produces insufficient or no insulin at all. People of all ages are affected by diabetes. All types of diabetes can be controlled with medicine and/or lifestyle modifications. However, the majority are chronic, lifelong. Carbohydrates in your meals and beverages are the primary source of glucose, or sugar. It is the primary energy source for your body. All of the cells in your body receive glucose from your blood to utilize as fuel. When glucose enters your bloodstream, it needs assistance, or a key, to get to its destination. The hormone insulin is the key. Consistently elevated blood glucose levels over time can lead to heart disease, nerve damage, and vision problems. What kinds of diabetes are there? Diabetes can take many different forms. Among the most prevalent types are type 2 diabetes. This type is characterized by insufficient insulin production and/or insulin resistance, which is the abnormal response of your body's cells to insulin. The most prevalent kind of diabetes is this one. Although it primarily affects adults, children can also be affected. The period preceding type 2 diabetes is known as prediabetes. Though not high enough to receive a type 2 diabetes diagnosis, your blood glucose levels are higher than usual. Type 1 diabetes. This autoimmune condition occurs when, for unclear reasons, your immune system targets and kills the cells in your pancreas that produce insulin. Type 1 diabetes affects up to 10% of individuals with diabetes. Although it can appear at any age, children and young people are typically diagnosed with it. Pregnancy can cause some persons to acquire gestational diabetes. After pregnancy, gestational diabetes normally disappears. On the other hand, having gestational diabetes increases your chance of getting type 2 diabetes in the future. How common is diabetes? Diabetes is prevalent. In the United States, 37.3 million people, or around 11% of the population, suffer with diabetes. 90 to 95% of all instances of diabetes are type 2 diabetes. Approximately 537 million persons worldwide suffer with diabetes. This figure is expected to increase to 643 million by 2030 and 783 million by 2045. According to experts, symptoms and causes diabetes symptoms include dry mouth and increased thirst, polydipsia, urinating a lot, exhaustion, vision blur, inexplicable loss of weight. Your hands or feet may feel numb or tingly, cuts or sores that don't heal quickly, recurrent yeast infections of the skin and/or vagina. If you or your kid experience these symptoms, it's critical to consult your healthcare physician. Here are some more specifics on the symptoms of each type of diabetes. Diabetes mellitus, usually. Gestational diabetes symptoms are invisible. Between weeks 24 and 28 of pregnancy, your doctor will test you for gestational diabetes. What causes diabetes? Any form of diabetes is brought on by an excess of glucose in the blood. Nevertheless, the cause of elevated blood glucose levels varies according on the type of diabetes. Among the causes of diabetes are insulin resistance. Insulin resistance is the primary cause of type 2 diabetes. When your muscles, fat, and liver cells don't react to insulin as they should, you develop insulin resistance. Different levels of insulin resistance are caused by a number of illnesses and circumstances, such as heredity, nutrition, hormone imbalances, obesity, inactivity, and some drugs. Autoimmune disease, when your immune system targets the cells in your pancreas that produce insulin. You can develop type 1 diabetes and LADA, hormonal imbalances. Insulin resistance is brought on by hormones released by the placenta during pregnancy. If your pancreas is unable to produce enough insulin to overcome insulin resistance, you may develop gestational diabetes. Type 2 diabetes can also be brought on by other hormone-related disorders such as Cushing syndrome and acromegaly. Pancreatic damage. Type 3C diabetes can arise from physical harm to the pancreas, such as an illness, surgery, or injury, which affects the organ's capacity to produce insulin. Genetic mutations. Neonatal diabetes and MODY can be brought on by specific genetic mutations. What are the complications of diabetes? Extreme or protracted high blood. Sugar levels are the primary cause of both acute sudden and severe and long-term problems associated with diabetes. Complications of acute diabetes. The following are examples of acute diabetic complications that can be fatal. Ketoacidosis associated with diabetes DKA. Those who have type 1 diabetes or undiagnosed T1D are primarily affected by this condition. It occurs when there is insufficient insulin in your body. Your body burns down fat for energy if it lacks insulin, which prevents it from using glucose. Eventually, this process releases compounds known as ketones, which cause your blood to become acidic. This results in vomiting, breathing difficulties, and unconsciousness. Diagnosis and test. How is diabetes diagnosed? Medical professionals use a blood test to measure your glucose levels in order to diagnose diabetes. Your blood glucose level can be determined using 3 tests. Fasting blood glucose test. For this test, you must fast for at least 8 hours before the test and consume nothing but water. This test lets your doctor assess your baseline blood sugar because diet has a big impact on blood sugar. Random blood glucose test. Random refers to the fact that you can receive this test whenever you choose, even if you haven't fasted. The results of the following tests usually show whether you have diabetes, prediabetes, or neither. These figures can differ a little. Additionally, other tests are used by medical professionals to detect diabetes. Management and treatment. How is diabetes managed? Since diabetes is a complicated illness, managing it requires a variety of approaches. Additionally, each person with diabetes has a unique set of symptoms. Thus, management strategies are quite customized. The following are the 4 primary facets of diabetes. Management. Blood sugar tracking. The key to assessing the effectiveness of your current treatment strategy is to keep an eye on your blood sugar, or glucose. It provides you with daily and occasionally even hourly diabetes management information. You can use a continuous glucose monitor (CGM) or a glucose meter and finger stick to check your levels frequently. Insulin. In order to live with and manage type 1 diabetes, a person must inject synthetic insulin. Insulin is also needed by certain individuals with type 2 diabetes. Synthetic insulin comes in a number of varieties. They all begin to function at varying rates and remain in your body for varying amounts of time. Rapid-acting inhaled insulin, insulin pens, insulin pumps, and injectable insulin using a syringe shot are the 4 primary methods of administering insulin. Diet. Because food has a significant impact on blood sugar. Meal planning and selecting a balanced diet are essential components of managing diabetes. A big component of managing insulin is keeping track of the carbohydrates in the foods and beverages you eat and drink. The quantity of insulin you require during meals depends on how many carbohydrates you consume. Maintaining a healthy diet can also help you control your weight and lower your risk of heart disease. Exercise. Regular exercise is a crucial component of diabetes. Therapy for all individuals with the disease, since it improves insulin sensitivity and lowers insulin resistance, because heart disease is more likely to occur. It's also critical to maintain a healthy weight. Outlook. What is the prognosis for diabetes? Numerous factors, such as the type of diabetes, influence the prognosis, or outlook, for the disease. Your ability to get diabetic care and how successfully you manage the illness over time. How long you've had diabetes and your age upon diagnosis. If you suffer from any further medical conditions. If complications from diabetes arise. Severe effects from persistently elevated blood sugar are typically irreversible. Untreated chronic high blood sugar reduces lifespan and degrades quality of life, according to several studies. Diabetes is the 9th most common cause of death in the U.S. Many diabetics will lose their lives to heart attacks or strokes. It's crucial to understand, though, that diabetes does not have to prevent you from leading a healthy life. A better prognosis depends on the following: a shift in lifestyle, frequent physical activity, modifications in diet, frequent checks of blood sugar levels. According to studies, maintaining an A1C level below 7% over time may help diabetics lower their risk of problems. Prevention: how can I prevent diabetes? Both hereditary and autoimmune types of diabetes cannot be prevented. However, you can reduce your risk of prediabetes, type 2 diabetes, and gestational diabetes by doing the following: consume a nutritious diet, like the Mediterranean diet. Engage in physical activity. At least 5 days a week, try to get in 30 minutes each day. Strive to reach a healthy weight for yourself. It is crucial to remember that certain risk factors for diabetes, like age, race, and genetics, or family history, are unchangeable. Recognize that type 2 diabetes is a complicated illness with numerous underlying causes. Living with: how often should I visit my doctor? If you experience any diabetic symptoms, such as increased thirst or frequent urination, but have not yet received a diagnosis, you should consult a healthcare professional. You should see your diabetic care provider, such as an endocrinologist, on a frequent basis if you have the disease. For more fascinating and educational videos like this one, please like and subscribe to my Body Talk channel if you like this one. Thank you for viewing, and I'll see you soon.